You're listening to Bio Talk with Rich Bendis, the only podcast focused on the biohealth capital region. Each episode, we'll talk to leaders in the industry to break down the biggest topics happening today in biohealth.
Hi, this is Rich Bendis. I'm the host of Bio Talk, and I have the privilege today of interviewing Dr. Jay Perman, who is the president of the University of Maryland, Baltimore. Welcome to the show.
Thank you so much. Good to be with you.
Great to be with you because I've interacted with you in many meetings here in Maryland and appreciate all the good work you're doing for the state and the community. And we're going to dig down a little bit into some of the details of all the good stuff that's going on at the University of Maryland, Baltimore with you today. But we're going to start with our audience to have them get introduced to you. So we want a little bit of background about Dr. Perman. So give us a little brief intro into your life history.
Well, first of all, let me say that I'm privileged to be honored with this presidency. I've been in this role as president of the University of Maryland, Baltimore for almost 8 years now. And no, there was no grand plan. I didn't set out in my career to become the president of a university. I grew up in Chicago. I probably knew that I wanted to be a physician by the time I was 5 years old. Fortunately, I stuck to the plan. I had opportunities given to me to finish my undergraduate education at Northwestern University, and then I matriculated to Northwestern University Medical School. I evolved in my training there with a desire to take care of children, and I frankly envisioned myself as spending a wonderful career as a general pediatrician. In my pediatric residency at the Children's Memorial in Chicago, I became interested in infants in particular who were hospitalized for weeks at a time with intractable diarrhea, intractable vomiting. Nobody seemed to know the mechanisms of their symptoms, their illnesses. It looked like a fertile field for research, and I announced to my family and the world that I wanted to be a pediatric gastroenterologist. Nobody had ever heard of such a thing in the 1970s, and fortunately, with the help of my chief, I found my way to Harvard University and to a research and clinical program there, largely focused on cystic fibrosis. That is about as close as anybody could come to the field of gastroenterology because that, of course, is a chronic genetic illness which has, in addition to lung disease, gastrointestinal disease. So I evolved as a pediatric gastroenterologist, recognizing that if I wanted to make a field or help make a field out of this career, I needed to stay in academics. And that brought me to a career in academia. My principal research focus was on the use of breath analysis to investigate gastrointestinal function. And that probably, Rich, was my initial exposure to the idea of taking something that you do in the lab and putting it out in the marketplace so that it can make a difference to people.
So you also actually, through your academic career, spent some time at some other universities. And I guess you went from one wildcat to another wildcat.
Well, it's even worse than that. And the old joke, of course, is that I'm one of those guys that can't keep a job. So after my education and training in Boston, I went out to the University of California, San Francisco, where I really cut my teeth as an investigator and learned what it means to do science, what it means to get funded for science, what it means to publish. It prepared me then to come back across the country to the Johns Hopkins University, which was my initial entree to Baltimore. You are right. I seem to hang around wildcats. I went from being a Northwestern wildcat to later in my career, and just before this job, being the dean of the medical school at the University of Kentucky, second wildcat job.
Great. Now we've converted wildcats to turtles, right? Or
That's
terrapins.
right. That's right. I'm very flexible.
Yes, you are. Most people don't understand the complexity and all of the enterprises associated with the university, and especially one as complex as the University of Maryland, Baltimore. Give the listeners a little background on everything that's comprised of this whole enterprise here.
So the University of Maryland, Baltimore can easily be described as a campus of the University System of Maryland, which focuses on graduate and professional education. To be sure, we have undergraduate programs here, largely in nursing, but our principal focus in this institution, which educates 6,500 students each year, our principal focus is on preparing individuals for careers in the health professions, medicine, dentistry, nursing, pharmacy, careers in human services, by which I mean the University of Maryland School of Law and the University of Maryland School of Social Work. And we have a thriving graduate school, largely to prepare scientists in the biomedical fields. Now, the complexity is added to by the fact that we have a very important sibling, the University of Maryland Medical System and its flagship hospital, the University of Maryland Medical Center here. They are not part of the university, but of course we're joined at the hip. And in fact, the medical center used to be a part of the University of Maryland, Baltimore until about 30 years ago when the medical center was privatized in order to compete properly in the healthcare sector.
And I guess you still have a close affinity to med schools because you're still practicing as a physician.
That's right. There's nothing wrong, Rich, with a president or an executive having a little fun. And I don't mean this tritely. That's my enjoyment. As I said, I've always wanted to be a physician. I don't care to give that up. Having said that, it's a privilege for me to be able to do that, not just because of the joy of caring for children, which is a joy, but also because it keeps me close to students. When I see patients, I have students from each of those professional schools that I mentioned. And the reason I do that is very deliberate. It's critically important today that people understand the power of team-based practice. Physicians, nurses, dentists, they can do what they do and they do it well, but it doesn't cover the waterfront, particularly in a society where we have so much to deal with around the social determinants of health, where a person lives, whether they have any money, whether they're health literate, whether they have transportation. All of these things make a difference to whether somebody heals. And I'm not skilled in those matters. I need my colleague lawyers and social workers, nurses who can educate, et cetera.
Also, one of the things you mentioned is when you were a student as well as doing research and publishing, you mentioned that's where you got your first association with potentially commercialization of this great science that's going on at the med school at the university. Another entity within the University of Maryland, Baltimore is the Biopark, which services both the university and the medical center. Could you tell our listeners a little bit about the Biopark?
Yeah, the University of Maryland Biopark is, and I often use this expression, one of the jewels in my crown. The Biopark really represents the vision of my predecessor, Dr. David Ramsey, who in the early 2000s looked across the street from the campus here in West Baltimore and saw a lot of empty lots, glass-strewn, contributing nothing to the city or the neighborhood except squalor and crime, and envisioned a thriving biopark, a separate entity existing for the benefit of the University of Maryland, Baltimore. And so the biopark grew up with that vision. It's now over 10 years old. It was named last year as the Biopark of the Year by the American Association of Bioparks. I probably don't have that name exactly right.
Association of University Research Parks, AURP.
There you are.
Right.
What would I do without you,
No,
Rich?
and
I often ask that question.
Because Brian Darmody from the system has been one of the officers of AURP and probably had something to do with promoting Maryland.
Well, listen, you know that I'm deviating for a minute, but one of I think my legacy achievements, together with my brother and colleague, Dr. Wallace Lowe, at the University of Maryland, College Park, is the creation of Empowering the State, this strategic partnership that we have with the University of Maryland, College Park. So if Brian Darmody, who is such a great force at College Park, helped to do this, he's doing his job.
That's good.
But the Biopark, we're very proud of the Biopark. About 36 companies, some startup, some more mature, companies that do clinical trials, companies that facilitate biomedical research, biohealth research around the world in other ways, some educational entities. In the Biopark, we have a proud partnership with the Baltimore City Community College, preparing kids from West Baltimore for careers in medical laboratories, diagnostic laboratories. The Smith School of Business from our College Park brethren is represented at the Biopark, helps our faculty and people in Baltimore get the kind of business training they need in association with becoming entrepreneurs. So lots of good things going on in the Biopark, including community engagement. We have a walk-in center where people in the West Baltimore community can take advantage of the gown. We sort of bring the gown down to street level to the town.
And I know you're really committed to the community and how important it is as a leading institution within the community, the impact you can have on the community.
Well, there's this frequently used phrase called anchor institution. And I think that we've done our part to give life to that phrase, to use what we're fortunate to have to make a difference to the community. We're particularly focused on children. We are particularly proud of a program that we call the UMB Cure program, which has had support from the NCI, the National Cancer Institute, and the NIH. We're very focused on making sure that the children in our community who have the same potential that any child has have the opportunity that they don't often have. So this is a program that's after school and on Saturdays, takes kids in the 6th grade. In middle school, we're working with 3 West Baltimore middle schools, and keeps hold of them, not just in a couple of Saturdays a year, and then we don't see those kids again. It's a pipeline, and we're trying to make sure it's a non-leaky pipeline. We want minority kids to get excited about biomedical science, to get excited about the potential of healthcare careers, to get excited about the potential of becoming themselves biomedical scientists. One of my great joys last June was for about 30 of these kids to hop on a bus with their scientific posters, 12-year-old kids with their scientific posters, presenting at the NCI to professionals, scientists from around the country, to watch those 12-year-old kids, some of whom very frankly have told me they've never been to downtown Baltimore, to watch them present their science to scientists. It's a moment I won't forget.
I think one of the things we've talked about is how important you think the development of human capital is in the world, but especially right in your own backyard. And your mission to create the STEM education opportunities at an early age of 6th grade will help shape some of the futures of these students that you're interacting with.
That's exactly right. The premise under which we decided to commit ourselves to these younger kids and get them excited in STEM fields is that if we wait, and so many programs which have had a modicum of success start in late high school or early college, for too many children, for reasons that are familiar to all of us, it's too late. They haven't had the right high school experience. They haven't had the right counseling. Yes, in some cases they've gotten into the wrong things. You need to catch them early and excite them early. And this is not simply a matter of social justice. As important as social justice is, we need Latinos and African Americans in science. We need these folks in scientific discovery. We are all concerned about healthcare inequities. Arguably, those young people with the greatest passion for solving healthcare inequities, why an African American with hypertension is probably going to have a different experience from you and me, or an African American with prostate cancer. What's the mechanism? The people with the passion to solve those are arguably more likely to be people who come from those families, those populations. So it's important for our science. It's important in terms of doing the right things. And finally, it's also important because you and I feel that biomedical science, biohealth, it's a great life. There are jobs. The healthcare professions, there are always jobs. So for a place like West Baltimore, this is workforce development.
And I think you're doing an excellent job. And one of the other things that we've talked about in human capital, in one of your roles we'll talk about later in the Life Science Advisory Board, is that you're working with sixth graders, but at the other end of the spectrum, the University of Maryland, Baltimore focuses on innovation and entrepreneurship education and training as well. And we all know that one of the things that we get gigged about in this region is that we don't have enough serial entrepreneurs or people who can step in to run entrepreneurial businesses. Talk a little bit about the importance of this entrepreneurial education and training at UMB.
Well, I mentioned earlier that we're very proud of our graduate programs in the life sciences. And I worry about those folks. They are marvelous young people, very creative, and this is a discouraging time for too many of them, largely because they see in our model concerns about federal support for research, which can be threatened, probably a disdainful attitude too often about science. We need to make sure they stay excited. And they are very creative people. I have always admired the success that Stanford has with regard to biomedical research, to entrepreneurship. And my colleagues there always tell me that the most important secret to their sauce is their students, their graduate students. They excite them, get them into this field. So we want to make sure we give our students not just a traditional laboratory experience, but also the exposure to taking their science, taking their ideas, and knowing how to commercialize them. So as you know, because you help us with this, Rich, you teach for us. We've just created something that the students suggested, something that the students wanted, something that we call the GRID, the Graduate Research Innovation District. It's in our Biopark in a remodeled environment, and it's a place where students who have a developing passion for knowing how to take an idea and ultimately develop it, bring it to market, can engage with each other, can engage with people like Rich Bendis, who know all about this stuff, can work with budding startup companies. We're trying to make an environment where our incredibly enthusiastic and bright young people see a future.
I appreciate the credit you're giving me, but really that credit goes to Ken Malone, who is our entrepreneur in residence living in Baltimore and is assigned to working with the University System of Maryland and has worked in helping create a number of startups within the Med Center as well as the university and teaches in the entrepreneurial courses. So I would give that credit to Ken and what he has been doing over the last 5 or 6 years to help spread the entrepreneurial culture in this region.
Well, let me comment on that, and I'm not going to let you give up all the credit because you do deserve it, sir. But you bring up the word culture, and it's something that we probably should spend a few minutes on. When I started my career in science, I was very naive, and it showed and continues to show in terms of not taking what I was doing in the laboratory and seeing the commercialization opportunity and the importance of bringing it to the marketplace. I tried. My research, as I think I mentioned, was focused on using breath analysis to investigate GI function. That became the basis for something that is used in the office today. It's called breath analysis. Lactose intolerance is a common application. But I also realized that you could make that into a little kit that you could use at home. And somewhere in my office, I need to show it you someday, is my primitive kit, which I brought to the tech commercialization people over at our colleagues at Hopkins a long time ago. But man, compared to what I did versus what's done today, boy, I wasn't much.
Well, you didn't exit from that kit then yet, right?
No.
Oh, okay. That's why you're still a president today.
Right. But to your point about culture, in those days, thinking about stuff like taking your incredible idea, your discovery, and doing more with it than publishing your work in a very good journal, that was a challenge because that was felt to be sort of going to the dark side, taking something and as a distinguished, not me, but as a distinguished investigator and talking about the marketplace. We still have work to do in that regard. And the Ken Malones of the world, the entrepreneurs in residence, the people that we call site miners, SITEMINERS, we have them roaming the labs. And we still encounter to some degree, I don't want to get involved with that, it's money, commercial, all that kind of stuff. What we have done in a practical way here at UMB and also throughout the USM is to try to change that culture by making victories such as those part of the basis for promotion. In other words, if you get hired because people see in you the opportunity to take things at the bench and commercialize them and then sell them as some of our faculty has done for many millions of dollars, you ought to get credit for that. We need to change the academy with regard to culture around valuing entrepreneurship.
I'm glad you mentioned that because I had the opportunity to have Britt Kerwin on my board for several years, and I remember the transformation that went with the system where actually startups was not something that was really highly promoted within the system.
Not at all. Either ignored or worse.
Right. And then basically it was if you could generate a license or a royalty, it would be a great thing. But just think if you could create a company, own equity in that company, like you've had some recent successes, what you might talk about, and what the benefit is to the community as well as what the payback is to the university that you can reinvest. I think this whole paradigm shift to where commercialization adds to tenure, which the University System of Maryland was one of the early adopters of this culture in America, and a lot of people in this region don't understand how progressive that was.
Yeah, Britt deserves a lot of that credit. It is terribly important, and you know, as you and I think about examples from our own faculty, we've had great success recently with one of our faculty who designed a less invasive way for treating cardiac valvular disease. We have a great investigator who's developed an artificial lung. We have developed a cholera vaccine. We have so many examples, cancer vaccines, immunotherapies for cancer, all things with importance to changing the human condition, but also commercial monetary value. And what's wrong with that? First of all, it gets it to the patients as opposed to simply sitting in a journal. And in addition, there are dollars that come back that fuel doing more of this.
Right. I think that whole sustainability is extremely important. I think you're helped create Ventures, which Jim Hughes at University of Maryland, Baltimore has been intimately involved in from its creation and is starting to yield major dividends now. Yeah,
so Ventures is one of the outgrowths of something I mentioned earlier, namely our Empowering the State, our strategic partnership with College Park. And I remember the early hearings related to why these two institutions couldn't work better together. Ventures came out of that because we listened to people you and I both know in the biohealth industry in the capital region who said, why can't this be easier? I want to have some help. I want to have some partnership with one of our great research universities. I don't know which door to go into. I don't know who to talk to. Should I go to Baltimore? Should I go to College Park? What about Hopkins? We wanted to simplify this to make it sort of a single point of entry, easy shopping. Great partnerships have evolved.
And you mentioned Johns Hopkins, and we're really fortunate in Baltimore to have two great research institutions with two med centers in the same city, which is very unusual. How have you seen the evolution of the collaboration and partnership between you and Ron Daniels and Johns Hopkins and the University of Maryland, Baltimore?
So a story, if you will.
Sure.
A personal story. I think I mentioned earlier that my entree to Baltimore was at the Johns Hopkins University, where I spent 12 wonderful years. Now, I need to tell you, and it's no secret, in those days, the idea of these two institutions doing stuff together, no. And in fact, one of the reasons I'm here at the University of Maryland is because somehow I convinced leadership at Hopkins and here in the early 90s to let me develop a joint academic program in pediatric gastroenterology. For whatever reason, they let me do it. And believe me, nobody here understood quite what I was made of and why I was doing this, and the people at Hopkins certainly thought I was some sort of a traitor. Now, that's the fact of the matter, and now I look at the way things evolve. We have a great partnership, Ron Daniels and I, over a lot of things, the welfare of the city, but even more constructively from a scientific point of view, we have now submitted the first for these institutions joint grant application for a clinical and translational science award. It'll be at study section soon. We hope to have a great result, but we are partnering in research, and we have a wonderful working relationship around a number of different entities to invest in research that we're doing with Hopkins. It's a long time coming. Nowadays, if somebody said, I want to go over to the University of Maryland and do something, you'd probably get a good reception at Hopkins.
Well, it has to start somewhere, right?
Yeah.
And baby steps will lead to something that hopefully will be elaborated on down the road.
It's a good relationship.
It's a very good relationship. But we have more we can do. So at the end of the day, the governor recognized that we needed to have a little more focus on the life science industry, which is one of the major industries within the state of Maryland. And there was an appointment to create a life science advisory board. And you and I have had the privilege of serving on that for the last couple of years. And you recently have been elevated to become the chair of the Life Science Advisory Board. Let's talk a little bit about how you see the role of that board and what your role is as the chair and what you would like to accomplish through the LSAB.
Well, first of all, you and I, as you've mentioned, have been privileged to serve together over these years. And in fact, the Life Sciences Advisory Board has been as meaningful as it is because it has around the table people like Rich Bendis, people who are also CEOs of a number of our most prominent companies in the life sciences, educators, representation, for example, from Hopkins, some of our federal agencies. It's an extraordinary group of about 20 people, which is staffed by the Department of Commerce, led by Secretary Mike Gill, who I believe is a member of your board at BioHealth.
Yes, he is.
Innovation. And our task, and we, I think, made great progress last year under the leadership of our previous chair, Dan Abdul-Nabi, and we're focused on making more out of the life sciences industry, the ecosystem that we all talk about in Maryland. We haven't done as well as our potential says we can do. And together, I'm a convener. I gather these folks around the table. That's my role as the chair. And I think that we've developed a very good set of recommendations for the state to consider in terms of moving the biohealth sector in Maryland. It is a great opportunity together with cybersecurity, and that reminds me that the governor and his leadership team has developed an initiative called Excel Maryland, and this group is developing initiatives which hopefully will move biohealth and also move cyber. I see the Life Sciences Advisory Board as being the working arm for the state with regard to furthering the biohealth sector in Maryland. It's a great opportunity for the economy, great opportunity for jobs, and I always bring it back to the fact that in the end, what we're doing is trying to make people's lives better.
I agree with that. And I think that there's a challenge, an educational challenge for people within Maryland to understand all of these acronyms that we talk about, LSABs and Excels and all of the different initiatives. And
Me too.
And I'd be remiss if I didn't mention a person that we're both fond of, Chancellor Corrett, who's on my board now, serves on the Excel board, and you're on the LSAB board. So I guess the question
is, ought to be able to lick this problem.
We should. And do you believe that we have the level of integration and communication we need between those two boards to really make something happen?
Well, you're asking a very direct question, and I'll try to give you a direct answer. In my role as chair of the LSAB, I am constantly asking the question about how we integrate well with what's going to come out of Excel. And my boss, Chancellor Corrett, knows that that's a concern of mine. Secretary Gill knows that's a concern of mine. We have a tremendous array of people on the Life Sciences Advisory Board. We need to make sure that whatever comes out of Excel is something we can move forward. Otherwise, we don't want duplication.
And I really think the key to all of this working is that if we listen to industry and what their needs are, and you have the MedImmunes, and you have Doug Liu with QIAGEN, who's going to be your co-chair of the Life Science Advisory Board, and Dan Abdenabi with Emergent, and how he understands the dynamic between having his innovation manufacturing center in Baltimore and his headquarters in Montgomery County. And people sometimes say, that's the longest 35 miles in the world to go from Gaithersburg to Baltimore, and what we need to do is bridge that gap, and hopefully LSAB and Excel can help close that gap that we have between that community.
Well, I agree with that, and you bring up gap, and you bring up the real issues of distance, and it reminds me to also point out that in addition to what we can do as a board to virtually bridge the gap, we've got to find more and better ways to get the various sectors working in proximity to each other. By that I mean that we haven't realized our full potential related to universities interfacing with the biohealth industry. We ought to find ways to put physically overcome issues of governance, et cetera, and bring the scientists in academia better together with the scientists in industry. Ditto for the federal labs. We need to find ways of mixing it up for people, letting them rub shoulders with each other. I've always admired the ideas that emanated, I think, originally from MIT in the way they construct and populate their research buildings. They put disparate kinds of laboratories together because they know that incredible collaborations will emerge.
Well, I hope that all of these acronyms we talk about will cause people to talk more effectively with one another. And I believe under your leadership, we're going to be able to take some steps to correct some of these deficiencies we have. We're going to close with just a couple more things. One is you've got a major enterprise you're running in a very innovative state. What do you see as the major challenges for the University of Maryland, Baltimore over the next 5 years, and what are the major opportunities that you have?
Well, I could easily revert to what we all cry about, particularly in academia and particularly in public education, and that is insufficient funding. And that is a real issue. But I think that money in some ways, I shouldn't say this, but money in some ways is often the easier problem to solve. The bigger challenges that I think we have are some of the things we've talked about in this last half hour or so around culture, around artificial divisions, the academy, industry, the government. I think that if there is a challenge to be overcome, it's overcoming our silos, overcoming our individual cultures, because, it's that old Johnny Wooden expression about, it's incredible what a group of people can do together if nobody cares about who gets the credit. We have to break down our balkanization. That is probably going to be harder even than the money. For myself, for my little part in it, when I was inaugurated in 2010, gave a inauguration speech that was entitled Leadership by Collaboration. If we want to be leaders in Maryland, then through the Life Sciences Advisory Board to the things you do, Rich, and I do, what we can lead by is in saying, let's get together.
Well stated. And we have been talking with Dr. Jay Perman, who is the president of the University of Maryland, Baltimore. And I'm going to close with Dr. Perman by asking him one last thing, and that is, let's talk about your legacy and your tombstone. And what do you want that to say, and what do you want to be remembered by for what you have done throughout the United States, not just here at UMB, but what is the most important thing that you think that you are focusing on in your life?
Well, this gets me anxious when people ask about my tombstone, and,
You're going to be around a long time, Jay.
Well, thank you for reassuring me. This is trite, and I won't pretend that people haven't asked me in the past. I hope that people will say, long after I'm gone, what would Jay say about this? How would he want it done? If that happens from time to time, I will have felt that I've done something.
One of the things you've demonstrated is you're a good listener. So I think that basically what you are reflecting that you would hope to be your legacy is something that will actually come true.
Thank you, sir. Thank you for having me.
You're welcome. And I'd like to thank Dr. Jay Perman, president of the University of Maryland, Baltimore, for being on BioTalk, and hope that we can continue this dialogue for many years into the future.
Thanks for listening to BioTalk with Rich Bendis.